But, oh, you're muted. You can correct me.
Yes, you said it right.
Oh, phew. Okay. I usually check that. So Jen's practicum was with Dr. Ethan Walker, who's an associate professor in our School of Public Health. And the name of Jen's presentation is AIRWISE, Development of an Enhanced Indoor Air Quality Intervention through Leveraging Cross-Sector Collaboration. So take it away, Jen.
Great. Thank you, Lee, for the introduction. So I'm Jen Faiella, and I was very fortunate for my APE to work with Dr. Ethan Walker on his CFAR project to develop an indoor air quality intervention targeting an at-risk population. So Ethan, thank you so much for agreeing to be my site mentor. I also want to thank Taylor Stewart, who is the research associate on AIRWISE. And she and I worked closely together this semester, and she was definitely a mentor to me as well. And then thank you, Lee, for being the wonderful academic advisor. So just to provide some context to my APE, as we all are very aware, wildfire smoke exposure is a significant public health concern as we continue to experience unprecedented wildfire smoke events year after year. There's growing evidence that supports an association between exposure to smoke pollutants such as PM2.5 and adverse health outcomes. And public health messaging has really gone from staying indoors during these smoke events to the importance of creating clean air spaces within the indoor environment. So one of the aims of Ethan's project was to establish an air pollution advisory committee to develop an enhanced household level indoor air pollution intervention. And so the Air Pollution Advisory Committee, we call APAC, it was established to provide expertise and guidance on the intervention development. It consisted of, or consists of 7 committee members from the University of Montana, Missoula County Air Quality Advisory Council, and Climate Smart Missoula. And within our APAC group, we used the theory of change as both a planning and issue framing tool. So we first identified our long-term outcome, which is to develop an intervention to reduce PM2.5 exposures for patients with pre-existing cardiovascular disease. And then we identified 3 intermediate outcomes or preconditions that we felt were necessary in order to reach our long-term outcome. And then we identified interventions that we believed to be effective and feasible and scalable for future intervention trials, as well as accessible to our target population. So beyond our APAC group, our research team, which consists of myself, Ethan, and Taylor, and we call ourselves JET, we collaborated with the CFAR IS Corps researchers with Providence Heart Institute. And then we also had a really valuable discussion with patients from Providence who represent our target population. And they volunteered to speak to us about our intervention design and just provided some really valuable feedback. So that was extremely helpful. So this is a timeline of our APAC group. We first met a year ago in May of 2023. And throughout this last year, we've met on a monthly basis, and it's really exciting. Ethan just received IRB approval last week, so that's wonderful. So through collaboration with APAC, CFAR, and Providence, we accomplished our aim of developing an indoor air quality intervention, which we call AIRWISE. And AIRWISE stands for Air Improvement and Real-Time Monitoring for Wellness through Interactive Strategies and Education. And AIRWISE is a 3-prong intervention, which utilizes equipment behavioral recommendations, and education. And the education really focuses on guiding equipment use and behavior changes, as well as increasing knowledge and understanding about the health impacts of PM 2.5. So my products for my APE were really focused on the education piece of AIRWISE. So my first product is a decision matrix, which provides guidance for AIRWISE participants on how they can improve their indoor air quality in their home. It augments equipment that we'll be using in the study, which includes HEPA filtration units and an air quality monitor called the Purple Air Zen. And the Purple Air Zen is really cool. It has an LED light that changes color in real time based on what the air quality, what the PM levels are in the home. It aligns with the standard air quality index levels, such as green is good, yellow moderate, and so on and so forth. So depending on what color the Zen is, participants then can reference this decision matrix, which provides instructions on HEPA use, ventilation, and activity modifications. So the Purple Air Zen is like not only a visual cue to participants, but it also reinforces behaviors and is really empowering for participants because they can see that the actions that they take to improve their indoor air quality actually do work. So AIRWISE participants will also receive text messages throughout the study if outdoor air quality alerts reach a certain threshold. And so we provided guidance on actions to take when the outdoor air quality is either unhealthy or hazardous, and that information is on the bottom ribbon of the decision matrix. And then we also included some language around heat exposure. So another product of mine was this simplified decision matrix. It includes all the same information and guidance as the previous one, but just in a more simplified way with less words. This is being made into a refrigerator magnet because it's really easy to misplace papers, but we felt that a refrigerator magnet would just be a nice visual cue and easily accessible for participants throughout the study. And then my last product was, or is, an information brochure titled "Why Does Particulate Matter Matter?" which I think is catchy. It describes what particulate matter is, indoor and outdoor sources of PM 2.5, the health impacts of PM exposures and who is at risk, and then provides empowering and just simple steps that people can take to improve their indoor air quality and protect their health. And we provided QR links that just are like a convenient way for participants to learn more about air quality through like airnow.gov and the EPA. And so these are my competencies. Just for sake of time, I won't go through them, but I do feel that my deliverables aligned nicely with both my foundational and concentration-specific competencies. And then as far as challenges, it was definitely challenging to find that sweet spot in intervention design between what is going to be simple and feasible for participants and will not be burdensome to them, yet will still be effective. It was also somewhat of a challenge to manage messaging between the risks of smoke exposure versus heat exposure, since they often occur in tandem with one another. And then another challenge was how to incorporate our outdoor alerts into our decision matrix. At one point, we could have had like 16 different pathways of actions that people could take based on the combination of indoor and outdoor air quality. And so we spent a lot of time within the APAC group and our JET group, just trying to decide how we can incorporate these outdoor alerts into the decision matrix, while keeping it simple and easy for participants to understand and follow. As far as successes, I think this is really timely. There's definitely more attention being paid to the importance of indoor air quality, as well as the need for more intervention research and risk communication regarding wildfire smoke exposures. And then our collaborations with our APAC group and Providence were definitely a success. It's really encouraging to see how many people in our community really care about this topic and are working collaboratively and creatively to help protect public health in the face of more severe wildfire seasons. And then lastly, I just want to say thank you so much to everyone who helped inform my project and to everyone who were really instrumental in the development of AIRWISE. And that's it. Thank you.
Thanks, Jen. Great job.